Welcome to Health Systems CIO's interview with Dee Young, Chief Information Security Officer with UNC Health Care. I'm Anthony Guerra, founder and editor-in-chief. Dee, thanks for joining me.
Thanks so much for having me, Anthony. This should be a great discussion.
Yes, I'm looking forward to it. Can you tell me a little bit about your organization and your role?
Sure. So UNC Health is an academic medical center, and we also have an integrated health system. We're across the state of North Carolina. We have about 1,200 plus physician clinics and physician practices, and a really big tie with the University of North Carolina system.
Very good. Very good. All right, I'm gonna start out with an open-ended question here, and just see what's top of mind for you. What are you thinking about? What are you looking at? What are some trends maybe that you're saying, hey, I want to make sure we're set up to handle this, or any, without naming vendors, any general technologies that have caught your eye? I just want to see what you're thinking these days, and then we'll go from there.
Yeah, so always top of mind is medical device security. In healthcare, that's such a key risk area for us. And I think all CISOs and security professionals in healthcare are really trying to get our arms around the proliferation of connected medical devices that are really pivotal for patient care and clinical operations. As you know, many of these devices are very precision-oriented devices that can be in the clinical setting for years and years and years. And a lot of times their operating systems aren't as robust as we would like in our industry. And so we deal with a lot of legacy operating systems that our clinical and business leaders still need them to work and run. So we mitigate those risks quite a bit. The other area that I think is really kind of top of mind for us right now is just getting our arms around some of the AI initiatives. You right now in the news, we've seen Chat GPT and some of those other technologies that are really kind of getting a little more mainstream. And how do we set these up where, again, our clinical and business leaders might be able to use some of these tools or technologies, and we want to make sure that we do them in a way that we have governance and some of the protections that are needed. I think the emerging technologies is always an interesting space, whether it's digital therapeutics, your inhaler that can now send information back, or AI. Those are always fascinating to me. And also, how can I enable the business and keep us safe and secure?
Yes. All right. So lots there. So let's start with the medical device security. First question is, how do you break down, in the way you're looking to secure things? How do you break down medical devices versus non-medical devices that are still connecting into the network? Is that, I mean, is it sort of two buckets to you, or is it one bucket with some nuances in there? Obviously, when you get down to certain levels of business continuity, there's huge differences between a camera going out, a refrigerator going out, something that's on the network, a smart refrigerator, versus an infusion pump.
Right.
But at a certain level, just where you want to go with that question in terms of how that breaks down when you're looking at medical versus non-medical devices on the network.
Yeah, I think for me, really, I want to start at anything that connects to the network. So that's my first bucket. And, within that, it could be, tablets, phones, laptops, desktops, the traditional devices that IT is used to. OT, industrial control, or even, some of the IoT that we're starting to see, and medical devices. And medical devices, in my mind, can kind of overlap on all of those. So the very first thing is I want to know what's connected to our network.
Mm-hmm.
And then within that, we do bucket it out
Mm-hmm.
to a degree, because we have a clinical engineering team that those medical devices are things they've worked on for years and years and years, even prior to a lot of them being connected. So they have their preventative maintenance they need to do, and all the FDA requirements for those medical devices. And now in the last, bit of time, maybe 6-8 years, they're now connected.
Mm-hmm.
So there's an IT component. For our system, the clinical engineering reports up through IT. We made that move about 3 years ago because of all the connected devices. And that's been just a game changer for the cyber world for us. So we try to bucket them, for OT and facilities, again, that's another group that manages those. So in my mind, I don't really care who manages it, but I need to see that visibility. So that was the number one thing. I took on this role in February 2020. Great time to change jobs as a CISO.
Right.
Right before the pandemic. But one of the things that I really wanted to have first and foremost is visibility into the network.
Right. You have to know what's coming in. So it breaks down kind of, it would be facilities would be sort of dealing with the non-clinical, and then clinical engineering would be dealing with the clinical in terms of devices, and you would be working with both of those groups.
Yeah, and for us, there's one more, which is our physical security group that does badges, cameras, alarms, tube system, those types of duress systems. And so it's really three main groups that we try to work with: the clinical engineering, the facilities, the protective services, for the connected devices in our organization.
Can you tell me any more about the physical security group and what they do, and the relationship that a CISO should have with the physical securities group?
Yeah, I think it's paramount. And in my prior organization, we actually had physical security that reported to the CISO, and also had the CISO report up. So that was a wonderful thing to see. And so they were able to align all of the cameras and the doors and protective services along with the cyber tools, and they got a more holistic view of their environment. With ours, it's a partnership that I've worked really hard with we actually have credentialed police in many of our organizations. So, working with the police force to better understand and look at some of those devices that are so key in investigations, whether it's cyber or a physical investigation, and working with them for retention logs and making sure that we have the great business continuity plans. And so I think that relationship is one of the most critical within healthcare. And I think the CISO or the security person needs to try to align as much as possible, because you think of the badges, the keys. And for us, as we're doing a HIPAA risk assessment, physical security is one of the things that we look at. Do we have good door locks? Do we have egress issues? Do we have where someone could walk off or take equipment, those types of things?
Yeah, it's really interesting. So when you think of some of the technologies that enable workflow, tap and go technologies where people don't have to keep signing in, you think about, possibly somebody walking into the health system, throwing on a lab coat, an imposter, somehow gaining access to a workstation. Perhaps the person was not logged out and someone, these are extreme cases, but they can happen. So there is a relationship there between cyber and physical, again, with somebody walking in, getting onto a workstation. Um, you also have those sort of CSI, show episode ideas of, I believe there's some sort of hacking sometimes where you need to be in a certain proximity to what you're hacking. That's where cyber meets physical. So, these are kind of interesting things here. And again, your thoughts as a CISO on what you want to be doing to, I guess, at least bring awareness that these kind of things can happen.
Yeah, I think everyone is an expert at their area. So whether it's facilities or protective services, they know their tools, they know their risk. But I think having that communication and sharing our insights and our perspective really helps align these initiatives. When we're talking about, prolonged cyber event that could happen at a hospital, one of the biggest concerns I have is, what are our life safety systems and issues, whether that's, HVAC systems, whether that's a hugs system to restrict access for newborns, the doors to make sure that those NICUs and PICUs are locked down. It's the med dispensing cabinets that could be impacted. So it's those types of things that I really look towards those clinical and other experts within our organization to help us assess and mitigate, things that might keep me up at night, and know that others are working on, possible solutions as well.
It's such a great point. And I've had a lot of conversations with CISOs, and it seems like an important best practice is that for some of these folks you mentioned, and even for, emergency management, when you're talking about business continuity planning, you say, okay, I, as a CISO, I'm not going to figure out how clinicians are going to go to paper. I'm not going to do that. I'm not going to, but I do have to talk to emergency management because I need them to understand the possible scenarios, the cyber scenarios that could happen, so then they can go work out those details. But I have to let everybody know what cyber incidents can entail because they may not know. And I cannot assume that they are game planning out all these things, right? I have to take the baton so far and then pass it off. I can't just sit here. Does that make sense?
Yeah, and I think that's so important because, as a CISO, my biggest fear is that we have some major incident and our patient care is impacted. That's my why. I want to make sure that, systems are available and, people are able to work to take care of our patients. That's number one. And so one of the things we've done that has been really, really beneficial is, of course, we've done cyber tabletops, but we've done them at every entity with all of our leadership. And it's not talking about the technical response. It's talking about that business continuity and clinical operations. And really what we've seen is there's a shift as soon as we do these tabletops with the leadership, where we facilitate the discussions, and it's about those clinical operations, and especially with a cyber event, because it's a prolonged downtime that most hospitals aren't equipped. They've never gone through something, thank goodness, because of the IT resiliency and systems that we've matured in. And so having that communication with them, that helps me sleep at night, because then I have, the emergency preparedness group, we have the clinical, we have the business, and we walk through the scenario, and it allows them to see steps and gaps that they might need to take to make sure that they can take care of the patients. And then we can resolve the issue, technically. But, that all hazards approach of emergency preparedness is critical. And I think so many times the business and clinical leaders think it's just an IT issue until we have those tabletops. And then I think they really understand it's a business clinical issue and patient safety issue.
Right. When you sort of scenario it out for them and they say, oh, we had no idea. We didn't even realize that could happen, or we didn't realize that's the way it would happen, or we didn't realize that's the type of communication we might receive from you. And I'm just guessing it out, but you could say, okay, if there's a ransomware incident, here's a possible way it could happen. Here's a possible call you might get from me. And here's what I might say. I may say, that application that you live and breathe in every day to do your clinical work, it's going to be unavailable in 30 minutes. And it may be unavailable for weeks, right? You may get a call like that from me. You need to figure out what you're going to do if I give you that call. Is that something like how it works, those conversations?
Yeah, usually we do the tabletops and we really try to choose a system or application that would cause some disruption and have them go through. So whether it's PACS, so all imaging, whether it's all the Pyxis machines for medical med dispensing, something that would be realistic,
Right.
but also kind of allow them to see some steps we would need to take. And I think one of the key variables with a cyber event, as you know, Anthony, is just sometimes we don't know what's going to be impacted. We don't know what might ripple down, where we start with one system and then realize that it's spread, or we need to take down more keys of the kingdom to really protect the environment. And so I think that uncertainty is one of the things that we really discuss within the tabletops. How do you, as a clinical leader, make that call on, if some medical devices are up and some aren't, what's the clinical indicators of when you might need to divert patients or, move surgeries or different procedures. So it gets very complicated quickly, especially with one of the, the keys. I think I've been in the IT field long enough that I can remember when we worked to get people on electronic charting. And the issue now is we have many clinical experts that have never not charted on electronic charting. So when you have a prolonged downtime, you actually have the variable of teaching people how to chart.
But that's the thing. The thing is that theoretically, they have to know that, right? They have to have been trained on their end through emergency management, and their leaders, they have to know how to go to paper. They theoretically, right? But the thing with clinicians that's crazy, as I mentioned, my wife's a nurse practitioner. Clinicians don't seem to have any spare time.
Oh no.
So hey, let's all just figure out, just in case, let's practice working on paper. Let's get all the forms out. Let's get that. There's very little time for that, which is why these scenarios are so scary, because as much as we want to game plan and tabletop and all these kind of things, we know that going to paper is extremely painful in many ways, patient safety ways, stress ways. It's a very unpleasant experience. You and other CISOs are doing everything you can to prevent it, but there's so many nefarious actors out there. I don't know. It's I guess you do what you can, right? But it's just it's a tough situation.
It is. And what I love about healthcare is we'll figure out a way.
Yeah.
We'll get through it, and we'll do the best for our patients. And so some of this you really can't plan in advance, but I do think you know, the documentation and practicing downtimes in the daytime with different staff, so many of the technical downtimes and trying to prepare are usually nights or weekends. And what we found as an organization is we need to make sure everyone understands how to work with the downtime. And the other issue that we've seen is shift changes or prolonged downtimes. That's usually EHR downtime, maybe 4 hours at the very most, but rarely do you go past 8 and then 12. And, a cyber event does that. And just simple things like, do you have enough paper?
Yes.
Yep. You have enough paper, just basics. But I think the industry is doing a really good job with giving every hospital or organization great tools for their response. And I think it's also paramount to point out, one of the things that I'm really trying to do is working with our IT leadership is to find better ways for us to be more resilient as a network. So yeah, we have all these threats and threat actors coming at us, and how can we weather the storm so that we don't have that catastrophic
right.
And so that's also in parallel, I think is important.
I've been trying to get my mind around how CISOs like yourself are thinking about the job in terms of how you're spending your time and prioritizing. I mean, again, is it a bucket situation where we have a bucket for prevention? So we're going to try and keep bad things from happening, right? But a lot of what we've just talked about is when something bad does happen. So there's a recovery. Do you have in your mind, like on a whiteboard, how you're approaching your job in terms of are you got the prevention bucket and you have the recovery bucket, and I'm sure there's a million sub buckets under all those buckets. Like, how do you approach the job?
I think it's always a challenge. I think for me, absolutely. And what I'm trying to do is just those work streams, I'm just trying to move them forward. I might not be able to focus all day, every day on prevention. And I have great teams and great groups that work on different initiatives. And my goal is to make progress in each area and try to give my teams the tools and the technology or training that they need to be able to help us move those forward. But I do think it has to be a cognizant decision. If not, you get so much where you're firefighting and in the weeds. And I think, kind of like what I mentioned earlier with AI and medical device, kind of getting out of the weeds of the day-to-day and seeing, okay, how do we want to move this forward? I'm having a planning session with my GRC side of my team, governance, risk, and compliance, on, what are we going to do for the next 6-8 months within those work streams to make sure that we're ahead of the curve with some of the regulations or requirements that might be coming at us. So I think it's something that all CISOs really work towards. Some days are better than others. Some weeks are better than others. But yeah, I do think it's something.
So at the very least, you have to have your buckets identified, and you have to know who's working on those particular things, and you have to receive regular updates. So that type of thing. How about where you spend is you spending your time a matter of managing all that and making sure everyone's working on the right things and has what they need, receiving regular updates, and then sort of keeping that in line? Or is that all going and you keep that going and then you're sort of working on other things? Like, what do you personally put your hand into and work in as opposed to just having people report up to you and update you on what's going on? Where is a good place for you to be spending your time and capital?
Yeah, I think it's something that I continue to refine. Um, I personally like to help an initiative get started.
Mm-hmm.
So if we have a new initiative or a new area, I want to work with the team as much as I possibly can, give them direction. I always say give them navigational buoys, and then I hire excellent people.
Mm-hmm.
And so they know kind of how to drive it forward. We do touch bases. As far as my day-to-day, I'm really, I try to block out time for those initiatives that might take some just think time
Mm-hmm.
and research, whether that's AI governance or, kind of emerging technologies, just to kind of allow myself time to have deep thought.
Mm-hmm.
Um, as far as meetings, usually it's the high visibility, high risk types of meetings. So, our enterprise risk management group, our audit and compliance, work group, working with our IT leadership on new initiatives or new designs of data centers, or, kind of that emerging, how do we get our arms around type of meeting. I think a lot of my time the last year or two actually has been on investigations,
Mm.
whether it's a third-party breach and we've been notified and we need to better assess our risk, or a situation or an issue within our health system that maybe was a near miss, and we need to strengthen our processes or education to make sure that we don't have a major event, or kind of assessing new vendors or new technology at the system level that we might need to incorporate, whether that's a medical device vendor, a retirement vendor, HR process. I think those are where.
I think it's really interesting. I think that probably a good mark of success or failure or lack of success is, as an executive like yourself, is picking the right things to spend your personal time on. And I think if you get that wrong, you can get yourself in some trouble. If you were to say the things you mentioned, if you were to delegate those and choose other things to spend your time on, right? I mean, these are important decisions you're making, right? You delegate the wrong thing, it doesn't go well, and somebody higher up says, well, why wasn't Dee handling that? So you have to make good decisions there as a CISO, correct?
Yeah, I wish I could replicate myself sometimes, because there's so many meetings that, they need the CISO because there's a hard decision, and I joke with my teams, I don't get the easy buttons. I don't get the ones that are just simple. I get the gnarly, the, really hard, because everyone else has tried to figure this out. And by the time it gets to me, it's not easy, it's not simple, it's not fun. And that's what I try to remind people of is, that's why I'm in the role,
Mm-hmm.
is to really try to help make those decisions with great resources and amazing leadership with other parts of the organization. So it's not me alone, but yeah, I think that's key. And I also think, I I had a boss at one point that he played football in college.
Mm-hmm.
And he always said, it doesn't matter what you did last week, you could get cut this week. It was kind of that football game time mentality. And it reminded me that it doesn't matter what I did last week. I need to refocus, kind of look at this week. So I really try to manage my time in those types of blocks. You know, I work long term as well, but I think making sure, again, those work efforts, I've done a little, or there's been a little movement each week or each month, to make sure that I don't look back in 6 months and realize, oh, I haven't done anything in an area.
Yeah, I mean, it makes me think of sort of getting a plane in the air. It takes a lot of effort and energy to get it in the air, and then it should be all right. But you have to help get that thing started and also give them their marching orders, so to speak, and make sure they have general ideas of what you're looking for. And okay, once you feel like they're good, okay, you guys are good. You check in with me a little bit, but right, if you don't help them at the beginning, it might get all sorts of sideways.
Absolutely. And also blocking and tackling. You know, a lot of times with these new initiatives, there are change initiatives within an organization. And so, you know, while I might have an amazing senior security analyst driving this effort forward, sometimes they need the weight of the CISO and the information security office to help move these initiatives forward. And so I think that's where helping them and starting it out gives them a more successful project.
I could talk to you for another hour, but I'm not going to do that. We talked about time management. I'm going to ask you one more question, then I'm going to let you go. We talked about having great people. You know, everyone talks about a lack of cybersecurity talent. There's, you know, I've heard people say they've got plenty of open roles they can't fill. You have great people. You want to have great people. That means hiring is super important. I'm guessing that that's an area you dip your toe into, maybe for certain level positions. So hiring's super important, right? If we're going to have a great team, we have to hire well. And then we want to make sure that the people we have, we don't burn them out. It's a tough job. It's a lot of stress. It could be the kind of job where you're only noticed when something goes wrong,
Yep.
right? So your thoughts on hiring and then managing, I would love to ask you about how you keep yourself sane, but I don't know if we'll have to. Anyway, jump in where you want there and we'll make that our final question.
Sure. Yeah. You know, having a great team is one of the things that I thrive on, because I really enjoy working with other experts, and I think everyone on the security team has their expertise. So one of the things I really tried when I took on this role was I didn't want to break the team, because the existing staff was wonderful. They knew their jobs, they knew their roles, but we also needed to start adding people. So we really take a cross-functional role in the interviewing and looking for the right people to come onto our team and to add value and to really help support our culture within our office. One of the big things for me is it's us against the world. So, you know, the security team is tight. I love it. We help each other. We can, you know, it's a safe space, very collaborative. Also, I really try to focus on having each person have something they can own. I think is important, so that they can have mastery. And luckily, so far in my a little over 3 years, we've not lost anyone voluntarily, you know, whatsoever. No turnover. And in the hiring, we're careful, and I don't have open roles. I'm able to hire. And so while I understand that concern and you know, so many open roles for a lot of organizations, I think for us it is that balance. You know, we really try to allow people to have the time to recharge and to take care of their families and to do what they need to, because I want them in the role and on the team for long term.
Right.
That's one of the things that I really focus on.
That's great. That's a great philosophy and a great way to approach things, and a wonderful interview, Dee. I can't thank you enough for your time.
It's been wonderful. Thank you, Andy.